Occupational medicine, here to answer any of your questions about helping out your companies with your reportables. I mean, the baseline thing is making sure that you have safety teams and ergonomic teams and a health team all set up. If you've got the basics involved, then a lot of this is about understanding OSHA and understanding the psychology of your employees and understanding what they need and how to take care of them. And I think that's where I can help. When I first started at General Motors, people first come on the job and off the street, and then they would come on the line completely out of shape. They would get on a line on the job, working on a car, which is pretty hard physical labor. Their back would hurt and their shoulders would hurt. And when I first came on, every time one of those people would come in with the hurt, that would be marked as a report. Somebody would mark that down, give them some intervention that was considered OSHA reportable, whether it was a prescription strict ibuprofen, or they would send them to physical therapy, or they'd give them a day off work, or whatever that intervention happened to be that was reportable. I mean, was the company really causing them any injury? No. Had they done anything wrong? Not really. Was the person even hurt? No, they were sore. And so part of that was a classification and an education, and helping to teach the people that were triaging and helping to teach the supervisors that, hey, you're going to have what we call work hardening phase. You're going to have a period of time when people come on and they're going to be sore, they're going to hurt. Let them come off the line a little bit, give them some ice, let them rest a little bit, and then tell them, educate them that they're going to hurt for a couple weeks, and that's normal. It's like going to the gym, but as they get used to the line and they acclimatize, this will go away. It does not mean they're hurt. It does not mean there's something wrong if their body's going to fall apart. But anytime you get a new employee, you're going to have a decrease in productivity. It's less of a decrease in productivity than if you took the person off the line completely. It's better to have a person a little bit off the line for a few hours than it is to take them off for a day or two and off prescriptions for a few weeks and then or never have them come back. The federal government has what's called the OSHA log. OSHA stands for Occupational Safety, Health, Accountability, maybe? Anyway, the sole purpose of it was just to track injuries. It was not supposed to be punitive, it was not supposed to be financial, or nothing else in the matter. The only point of OSHA was to track injuries in different manufacturing. That's all it was supposed to do. And so they had what's called an OSHA 300 log, and every injury that met a certain standard on the job site was recorded in this book, and every company with over a certain number of employees had to keep track of these. Now it's used for all kinds of things. Everything from insurance premiums are based on OSHA logs to company exec bonuses can be based on OSHA logs. Now that's not what it's meant for, but that's what it's used for. And so it becomes a very, very big deal, and it's tracked very, very closely. What the numbers are on these logs and keeping these down, trying to keep insurance premiums down and your bonuses high. And just because they know workers' comp doesn't mean they know OSHA, because those are two very different things. Work compensability and OSHA reportability are not the same, and a lot of people don't know that. And it causes a lot of confusion. You can talk about Missouri, you can talk about prevailing factor. Prevailing factor means nothing. Those are not equivalent ideas. And so just because a doctor can say, hey, this is going to be compensable in Missouri does not mean it's OSHA related, reportable. And vice versa. Something can be OSHA recordable and not compensable. People get that mixed up all the time. I know the difference, and I know OSHA really well. And I know what's going to make the log, and I know what, better than that, I know what takes things off the logs. There's a tool that we have called an OSHA override, where if you go back and look at the data on something, and something does not meet it, you can do a strike off on that OSHA log and take it off. A lot of companies don't know that, and don't do that. I can talk to attorneys, I can talk to doctors, I can talk to supervisors, helping supervisors understand how to triage, how to tell first aid from what's OSHA reportable. I can go through OSHA logs for you. That's what I do. That's called the job site analysis. I've done a ton of them. And what we do is we go through and we look at, hey, what are the job site stressors here? What is going to be the source of possible problems in the future? Where could we switch things out? Some of it's little stuff. Are there mats that people stand on that keep them off the concrete? That's a really little thing. Are there counterweighted tools so that they're not carrying the weight of the drills all day? Are there butt caps that people wear that are doing overhead activities? Are there padded gloves? Real basic little stuff that you don't think of. All of that stuff is up for grabs and makes a big difference. That's something else I can help you with, is the rules on when to report. 8 hours for fatalities, 24 hours for serious injuries like amputations, like those kind of things. And OSHA is serious about that kind of stuff. when they want that stuff reported and how. Reporting hospitalizations, what gets reported and why and how. Triage is where what you do is you separate people from the not serious to the serious. And so if you've got two guys come in and one guy has a paper cut and the other guy has a missing finger, then you take care of the guy with the missing finger first, and then you let the paper cut guy wait. Once the guy with the missing finger has been taken care of, then you can handle the paper cut. We do have a starter guide for employers, and we've got a guide that you can contact me with this. I've found that a lot of employees, especially these mid-level employees, struggle with this because it's complicated. It's a complicated world dealing with these injuries and these recordabilities because it's not clear. What's defined as first aid by OSHA, there's a list of what's defined by first aid, but it can get kind of gray when you start talking about things like stretching, or when you start talking about things, people will start giving out rigid splits. Rigid splits are recordable, but a non-rigid splint is not. So what happens if you take the rigid part out of a rigid splint and give that? Well, most people think that's okay. That's about building trust. And I think the first thing is you got to take away any idea of punitive out of this. It's really important to start a campaign about the health there. You have a health fair campaign in there so that they're encouraged to use the health system there. So health fair campaigns have been shown to be very powerful tools within systems. Just because you're saying that I have some kind of health system means that you encourage it. And so if you ignore it or act like it's not there, then people are automatically have a problem with it. Second, what you do is you make sure that when people go, you don't give them a hard time about being off production. Because the thing is that it's short-sighted to give people a hard time for the hour or 2 hours they're off production. Because in the long term, it's much less than the week or 2 weeks or 3 weeks that they'd be off otherwise. It's exactly what I do. I have an individual case come in and say, hey, I've got this person come in, what do I do? And I'll tell you. Right, well, it takes the doubt out of it, too. Because then you're not sure, do I send this person to the ER now? Because you go to the ER and you're automatically getting a lost work day. Because anytime you send to an ER, what they're going to do is they're going to take them off work the next day and they're going to bandage them up. And a lost work day is a bigger hit on your OSHA log. Whereas you don't send them in, you don't get the lost work day, you get a restricted work day. And that's policies you can set up with me too, is that make sure that people go back to work the next day on restrictions as opposed to a lost work day. It makes a big difference. On where you are and where I am. If you had a clinic there set up, I don't have a clinic myself to bring patients into. To see, I'm licensed in Kansas and Missouri, and so I can see patients in either one of those states. Like I could go out, I guess, on a period if you had a place for me to see patients. But you can. The problem is that it pulls from everything. And so you're going to get some weird stuff. It's going to be off a little bit. Like when it comes to medical causation, it's going to be inaccurate. It's going to pull from everything. You're not going to be able to do OSHA overrides. Or if you do, they're not going to make sense. So they're not going to hold up under any scrutiny. And you're not going to have any medical expert backing behind it. So you're not going to be able to do any overrides. You can use ChatGPT if you want to try to triage, but if you're wrong, that's on you. And I feel uncomfortable doing that without having a doctor behind you. That comes back to using your non-occupational medicine doctors to make that decision. But like I said, they're not focused on your recordabilities at all. And so they're going to make a decision based on other factors. And so it's not going to help you bring it. I worked with all kinds of industries. I worked with manufacturing, I worked with warehouses, I worked with Boeing, I worked with Amazon, I've worked with Metro Bus Link, I've worked with hundreds. I worked with all kinds of companies. It doesn't do any good to go to 2024 because that year is done. And so we'd have to stick with 2025 because that's a different fiscal year anyway, so it doesn't make any difference. Okay.